Hello everyone, welcome to Nursetra again, and today we will continuing with OSSSC Nursing Officer previous year question that already held in 19 March 2023. We already discussed some question, and for today part B we are continuing with this. For today the first question is drug of choice to treat leprosy is option A rifampicin, option B acyclovir, option C judovirin, and option D is dapsone. Here the correct answer is option D. According to the old guideline, here the correct answer is option D. But now the for the leprosy, the drug of choice is MDT, multi-drug therapy, and it is also have some criteria. Leprosy is classified in two types: possibacillary and multibacillary. If patient having or client having 1 to 5 skin lesion, we are considering that one possibacillary, or patient having more than 5 lesion or any smear positive, we are consider it as multibacillary. And in case of possibacillary, we are using MDT, that RD, R for rifampicin and D for dapsone. And in multibacillary, we are using RCD, rifampicin, clofazimine and dapsone. These are the treatment regimen for treating leprosy, but this one is the old question. According to this question, the option D is correct, and option A rifampicin, it's also used in tuberculosis, so no specific for the leprosy, so we will eliminate this option. And acyclovir, this is antiviral drugs, and judovirin, it is antiretroviral drugs, we are using in the case of HIV only. So in this case, option D, dapsone, will be the correct answer. Next question: paracetamol is an antipyretics, antitussives, antibiotics and antiemetics. Everyone knows this is very common question. Paracetamol is an antipyretics, we are using in case of fever, and option A is correct. Option A is correct. And option B antitussives. So antitussives we are using in case of cough, and option C antibiotics. We are using antibiotics killing bacteria and all. And option D antiemetics, we are using in case of having like vomiting and all. So in this question, option A is correct. Next question: what do you mean by first stage of labor? You already know there are 4 stages of labor, and here question is asking about first stage of labor. Option A onset of true labor pain till full dilation of cervix, and option B full dilation of cervix to expulsion of fetus, option C expulsion of fetus to expulsion of placenta, option D is observation for at least 1 hour after the expulsion of placenta. But question is asking first stage of labor, so correct answer is here option A onset of true labor pain till full dilation of cervix, it is the first stage of labor. And option B full dilation of cervix to expulsion of fetus, it is second stage of labor. Option C expulsion of fetus, expulsion of placenta, it is third stage of labor. And option 4, it is observation for at least 1 hour after expulsion of placenta, it is fourth stage of labor. So here option A is correct. Next question: MTP can be done up to A 12 weeks, B 16 weeks, C 20 weeks, D 10 weeks. This question, friend, according to the old guideline, now MTP guideline changed, and according to the old guideline, here the answer will be the 20 weeks. But now this one updated, and according to the updated guideline, MTP amendment came 2021. Now MTP can be done till 24 weeks of pregnancy, except in case of contraceptive failure, MTP done till 20 weeks only. And in case of severe congenital anomalies of fetus, then there is no upper limit, but required 4 members like gynecologist, radiologist, pediatrician, and person who is assigned by the court. And for till 20 weeks, there is single doctor opinion is needed, and for more than 20 weeks, matlab 20 to 24 weeks, 2 doctor opinion is needed. These are the some important points regarding MTP. Okay, we will see next question. For this question, answer is option C. Next question: a client with chronic schizophrenia who takes neuroleptic medication is admitted to the psychiatric unit. Nursing assessment reveals rigidity, fever, hypertension and diaphoresis. This finding suggests which life-threatening reaction? Here patient having schizophrenia, also patient taking neuroleptic medication. After taking medication, patient having rigidity, fever, hypertension and diaphoresis. Option A is tardive dyskinesia, B is dystonia, C is neuroleptic malignant syndrome, D is akathisia. Then which one is the correct answer? Here the correct answer is option C. Why option C? Why not other option? In option C mentioned neuroleptic malignant syndrome. Already in question key point already mentioned, patient having rigidity, fever, hypertension, diaphoresis. These symptom is showing that medical emergency. So in neuroleptic malignant syndrome these symptoms are coming, so option C is correct. Why not other option? Option A tardive dyskinesia. Tardive dyskinesia is nothing, it is like sudden twisting of the neck and lips masking. These are the symptoms of tardive dyskinesia. Here this symptom is not mentioned, so option A will eliminate. Option B dystonia. Dystonia is like a sudden twisting of the muscle. So option B is incorrect. Akathisia meaning restlessness, so option D also incorrect. Here the option C is correct. Next question, when is the best time to achieve pregnancy? Option A is midway between 7 to 8 day of ovulation. Option B is immediately after starting of menses. Option C is 14 day after beginning of period. Option D 7 days before the next period is expected. Already you all know in 28 days of menstrual cycle, day 14 we are we know already that one the ovulation day, and fertility period is fertility risk is high in that day, and we are considering 11 date 11 to 16 is the high fertility period. So according to that we are choosing the option, correct option is option A, and other option is incorrect. Next question, which of the following factor may affect the drug absorption rate from IM injection site? A muscle tone, B muscle strength, C amount of body fat in at injection site, D is blood flow to the injection site. Here question is asking about the absorption rate of the injection site. So greater the blood flow, greater the absorption rate. So we will choose here the option D is the correct answer. And option A muscle tone, muscle strength is not affecting the absorption rate of the drugs, so we will eliminate. Here the correct answer is option D. Gallows traction is used for option A fracture of shaft of femur, option B fracture neck of femur, option D fracture tibia, and option C fracture humerus. Here the correct answer is option A, cause and gallows traction usually used under 2 years of children if children having fracture of shaft of femur. And other option fracture neck of femur, for this fracture we need surgery only. And option C fracture of humerus and fracture of tibia, option D, for that we need other tractions. So here option A is correct. Next is an ABG analysis report shows pH is 7.20, PCO2 is 35 mmSg, and bicarbonate is 20 milliequivalent per liter. This finding are suggestive of option A metabolic acidosis, option B metabolic alkalosis, option C respiratory alkalosis, option D respiratory acidosis. Here we will go to the ABG analysis. pH is 7.20. You know the normal pH is 7.35 to 7.45, 7.35 to 7.45. So here the pH is 7.20. 7.20 means pH in lower side. If pH in lower side, we are considering acidosis. Again, next value, carbon dioxide is 35 mmSg. Normal carbon dioxide is 35 to 45 mmSg. So here 35, it's slightly normal only. And next is we will go to the bicarbonate value is 20 milliequivalent per liter. The normal bicarbonate value is 24 to 26. Okay, here the bicarbonate value is 20 milliequivalent. So there is less bicarbonate. As pH 7.20, it indicates acidosis. Okay, and here PCO2 is normal, slightly normal. So we are not correlated with respiratory condition. We are correlated with metabolic condition cause bicarbonate is low only. So we will eliminate respiratory alkalosis and respiratory acidosis, and next we will choose metabolic acidosis or metabolic alkalosis. As we already know, this is metabolic condition, and again we have to find out acidosis or alkalosis. As the pH value is low in lower range, so it indicates metabolic acidosis. So option is A is correct and other option is wrong. Okay, next question. Best test to detect iron deficiency in community is A is transferrin, B is serum ferritin, C is serum iron, D is hemoglobin. Here the correct answer is A is transferrin, B is serum ferritin, C is serum iron, and D is hemoglobin. And question is asking about community in deficiency, iron deficiency in community, how we will detect. Here the answer is serum ferritin. Cause here answer is serum ferritin. Cause transferrin is option A. Transferrin is not we will see yearly. Okay, transferrin we will not see yearly, and option B serum ferritin only we will see earliest, and how much iron is stored we can know by testing serum ferritin. And option C serum iron it can change every day, so it is not that much diagnostic test that will diagnose iron deficiency. And option D is hemoglobin. Hemoglobin is the in later stage we can go for hemoglobin test, but in earliest stage we can do serum ferritin test. So option B is correct here. Then the elbow is dash to the wrist. It is very common question. Elbow is proximal to wrist, okay, near to the trunks. So it is very common question. Next question we will go. Which of the following is significantly different between human and cow's milk? Okay. A is protein and fat, B is protein and sugar, C is protein and lactose, and D is minerals. Okay. So here option is cow milk, differentiate between cow milk and human milk. Okay. So here correct option A is proteins and fat, and option B is protein and sugar, option C is protein and lactose, and option D is mineral. Here correct option will be protein and lactose, because human milk have less protein and more lactose, so we can differentiate with option C only. Okay. So next question, the substance deposited in skin and sclera in jaundice is called. Okay. First one option is indirect or unconjugated bilirubin, B is direct or conjugated bilirubin, C is biliverdin, and D is stearocobilin. Here the answer is direct or conjugated bilirubin. Okay. Other option biliverdin is not associated with skin deposited in the skin and sclera in jaundice. So indirect option A, indirect and unconjugated bilirubin, is not correct, because bilirubin is directly attached or directly bound to the albumin in the tissue, so it cannot be deposited. So option B is correct here. Next question, which is the common nutritional problem associated with Down syndrome? Okay, here option A is obesity, option B is kwashiorkor, option C is marasmus, option D is vitamin A deficiency. Option A is obesity. The answer is option A, obesity. Because in Down syndrome the metabolic system is not working properly and there is less muscle tone, so obesity is the most common cause in Down syndrome. And option B, kwashiorkor, it's not kwashiorkor is the deficiency in the protein, marasmus is the deficiency of calorie, and vitamin A deficiency it lead to blindness, so other option will be eliminated, and the correct answer is option A, obesity. Next question, while giving NG feeding, which of the following nursing action prevent complication? During NG feeding, which action will prevent complication? First one, A option is advanced tube 2 centimeter, and option B, floss with 20 ml air. Option C, provide hypovolar position. Option D, block the air vent during feeding. Here the correct answer is option C, because if you will give Fowler position during NG feeding, it prevents the aspiration. So option C is correct. Why not other option? Option A, advanced tube 2 centimeter. We cannot advance tube to 2 centimeter because before confirming the placement, so we cannot do this one. Option A is incorrect. Then option B, floss with 20 ml air. No need to flush 20 ml air. There is no significant. Then option D, block the air vent during feeding. It's depending upon the tube. So option D is also incorrect. Option C is correct to prevent aspiration. Next question, inadequate intake by the pregnant woman of which vitamin can cause neural tube defect? A, folic acid, B, thiamine, C, niacin, D, riboflavin. Here the correct answer is folic acid. Folic acid, deficiency of folic acid lead to neural tube defect, encephalocele and anencephaly. These are the condition due to deficiency of folic acid. So here option is A is correct. And thiamine, niacin, riboflavin, these are the not actually condition where the neural tube defect will be happen. In case of vitamin C deficiency, scurvy can be happen. In vitamin D deficiency, rickets can be happen. Vitamin A, that lead to blindness. So here the correct answer is option A only. Next question. A nurse is performing CPR on adult patient. When performing chest compression, the nurse understands the correct hand placement is located over A, upper half of the sternum, B, upper third of the sternum, C, lower half of the sternum, D, lower third of the sternum. Here the correct answer is C, lower half of the sternum. Okay, it already clearly mentioned in the AHA guidelines how to give CPR, how to give effective CPR, and what are the positions, what are the depth of CPR. This already mentioned in the AHA guidelines, and this one is the important topic. We will discuss specially on CPR in another video. Next question. When taking apical pulse, where should be the nurse place the stethoscope? The nurse is checking apical pulse. Which one is the correct position to check apical pulse? Option A, just to the left of the median point of the sternum. Option B, in the fifth intercostal space at the level of mid clavicular line. And option C, between 6 to 7 ribs at the left mid axillary line. Option D, between third and fourth ribs and to the left of the sternum. Here the correct answer is option B, in the fifth intercostal space at the left mid clavicular line. Okay, and another is option A. Why not option A? Just to the left of the median point of the sternum. Here this position, in this position tricuspid valve is present, so we cannot choose this position to check apical pulse. Between 6th and 7th ribs, the left mid axillary line. Here also we cannot check, it is not actual place. And option D, between third and fourth ribs and to the left of the sternum. In this place, that aortic area, we cannot check apical pulse here. So option B is correct for this question. Phenylketonuria is detected by which urine test? A, Guthrie test, Sorry for misinterpretation. A. Gutheric test. B. Sodium nitroprusside test. C. C is the blood test, and D is the ferric chloride test. Here ferric chloride, here the correct option is, we will see the correct option here. Here the correct option is ferric. Here the correct option is ferric chloride test, because ferric chloride react with phenyl pyruvic acid in the urine, and that urine color become green and suggestive phenylketonuria. So here the correct answer is option D, ferric chloride test. And why not option other options? The Guthrie test, it is a screening test, okay. And another option B, sodium nitroprusside test, it is detect ketone, not phenylketonuria test. It is not for phenylketonuria test, it is for ketone test, homocysteine test, okay. And option C, blood test, it is for infectious disease or genetics disease. We are doing that one, blood test. So option D is correct and other option is wrong, okay. Next, Geeta returned from the post anesthesia care unit with nasogastric tube in place following a gallbladder surgery. She continued to complain of nausea. Which action would the nurse take? According the nurse, what is the nurse action nurse can do? A, call the physician immediately. B, administer the prescribed antiemetics. C, check the patency of the nasogastric tube for any obstruction. D, change the position. Patient having nausea after surgery, complaining nausea after surgery. So here the appropriate nursing action is check the patency of the nasogastric tube for any obstruction. Is any obstruction in the nasogastric tube that can lead to nausea, because there is no drainage of the gastric content, so that may be the cause, okay. And why not other option? Option A, call the physician immediately. Nurses role to assess first, after that they can inform to the physician immediately. We can, without assessment we cannot inform to the physician, okay. We cannot call to the physician immediately. So option A is correct. Option B, administer the prescribed antiemetics. We are not liable to prescribed medication, so here asking nurse's role, so we can't administer medication without doctor prescription. Again option C is correct. Option D, change the patient position. Without assessment we can't change the position. Is there any problem due to position, then we can change. So here the appropriate answer is option C only. Next question, which of the following tools does a nurse use to assess the cognitive function of client? For the cognitive function of the client, which test we have to do? That already you know, MMSEC, mini mental status examination. In this case, we are in this examination we are examining orientation and memory, attention, calculation. These are the 4-5 parameters we are assessing in this case for cognitive functions. So here option is C. And why not other options? Other options is Ishihara polychromatic plates. It is not assessment tools for cognitive functions. And Roshan ink blood test, it is also not assessment test for cognitive functions. It is for personality assessment. tools. Test for personality test, assessment tool for personality test. And option D is Goldberg depression scale. It is used for only depressions. This is the tool for depression. So here option is C only. The drug which is used to create aversion in alcohol dependence. Apomorphine, B propranolol, C diazepam, D is disulfiram. Here the correct answer is disulfiram. Here the correct answer is disulfiram. The drug which is used in creative aversion in alcohol dependence. Why not other option? Apomorphine is not the abortion for alcohol dependence. Option B propranolol, it is the beta blocker, so it is also not correct. Diazepam, it is used in the alcohol withdrawal symptom, not in the alcohol dependence abortion case. So option D is correct. Next, which of the action could aggravate the cause of flare-ups in patient with pruritus? Patient having pruritus, which action will increase the flare of pruritus? A. Sleeping in cool and humidified environment. Aggravate pruritus, which condition, which things will aggravate the condition of pruritus? Sleeping in cool and humidified environment? No, it is not aggravate the condition of pruritus. So option A is incorrect. Then daily bath with fragrant soap. Yes, it can be daily bath that with fragrant soap, that chemical may irritate the skins and it aggravate the condition of pruritus. Using clothes made from 100% cotton, yes, it is good for pruritus. And increased fluid intake, it also maintains skin hydration and all. So here option B is correct. Daily bath with fragrant soap. Other option is incorrect. We will here for this question option B is correct. The client has clear drainage from the nose and ears after head injury. How can the nurse determine if the drainage is CSF? How can nurse determine if the drainage is CSF? Option A, measure the pH of the fluid, measure the specific gravity of the fluid. C, test for glucose, test for chloride. Okay, so in CSF, as you already know, glucose is present, so we can test that fluid is there that one CSF or not by testing glucose. So option C is correct. Why not other option? Measure the pH of the fluid. We cannot measure the pH of fluid. Matlab we can, but that is not we will identify that is CSF or not by measuring pH. So B, measure the specific gravity of the fluid by nose and ear. The fluid is coming very slowly, so we cannot measure specific gravity. So option B is incorrect, and option A is also incorrect. Option C, test chloride for chloride, it is also incorrect. So next question, here the correct answer is option C. An adult has just been brought in by ambulance after a motor vehicle accident. When assessing the client, the nurse would expect which of the following manifestation could have result from sympathetic nervous system stimulation. Option A rapid pulse and increased respiratory rate. B is decreased physiological function. C is rigid posture and alter perceptual focus. D is increased awareness and attention. Question is asking about sympathetic nervous system is stimulated. What are the symptoms you can manifest in stimulation of the sympathetic nervous system? You can find out the fight and flight action. In fight and flight action, patient having high blood pressure, hypertension, tachycardia, tachypnea, increased heart rate, increased respiratory rate, dilated pupil. These are the fight and flight action. So here the option is A correct. A rapid pulse, increased respiratory rate and increased heart rate is the correct answer. And decreased physiological function, it is not symptoms of stimulating sympathetic nervous system. And option B, C, D is incorrect. Option A is correct. Next question, when the patient is acquiring infection from another person, it is known as A, cross infection, B, iatrogenic infection, C, opportunistic infection, D, nosocomial infection. Here the correct answer is cross infection. If patient having infection from another patient, that is cross infection. Find out other option. Iatrogenic infection, the infection patient getting during the medical procedure or any healthcare intervention. Due to healthcare intervention, if the patient is getting infection, that is called iatrogenic infection, so it is incorrect. Then opportunistic infection, due to low immune system patient getting infection, that is called opportunistic infection. And D is nosocomial infection, if patient is getting infection during hospital stay, that is called nosocomial infection. So here option A is correct, cross infection. So this is for today, and in next video we will discuss other questions. And thank you all. And if you are feeling it is beneficiary to you all and it's worthful, and please share and subscribe. And if you want anything else and any topic you demand, you put in the comment box, we will come with that in another video. Thank you.